Hi, you guys. Welcome back for our daily practice questions. It is day 150 and day 20 of our Pharm series. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But as promised, y'all, I told you I was updating my website to make it a little bit easier for you guys, and it launches later today. So be on the lookout for the notification of that new release. I have it set so that you are able to navigate for if you are a first time test taker or a current student. Or if you are retesting due to an unsuccessful attempt, it will navigate you through and with all the resources and freebies and additional tools to take you to be successful, like the other thousands of nurses and nurse practitioners I have worked with over this past decade. And before I get into my questions, y'all know I always want to go over my disclaimer that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on both the ANCC as well as AANP exam. Any of my videos that I teach on that are things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, as always, I tell y'all, don't forget to hit the subscribe button so you're not missing any of my videos, especially the launch notification later today. And as well, if you're wanting to gain access to my NP Test Success Toolkit that is free, it's linked in the description. All right, y'all. Question number one. A 50-year-old woman has a fasting glucose of 112 milligrams per deciliter and an A1C of 6%. Let's start over. A 50-year-old woman has a fasting glucose of 112 milligrams per deciliter and has an A1C of 6.0%. What is the best first-line treatment for this patient? Is it A, metformin? Is it B, start basal insulin? Is it C, lifestyle modifications with diet and exercise? Or is it D, a GL1 receptor agonist? Take a moment to tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what is even being asked of you, right? So here the stem of the question states, what is the best first line treatment for this patient? And y'all know I always tell y'all, if they're asking for a treatment, you got to run it back and see if they've already provided you with a diagnosis. If they have not, you got to run it back a step further and look at those assessment findings so that you can determine what it is, because you got to know what it is to be able to treat it, right? So here, the diagnosis is not provided. So let's walk through with the assessment findings. So what is that chief complaint? What are those signs and symptoms? What is their age, their gender, their ethnicity, if that is provided, right? Because this can help you tie together and determine a diagnosis. So make sure you're paying attention to all of those key points. So this is a 50-year-old female. Chief complaint, nothing listed, but she comes in and has a fasting glucose of 112 and an A1C of 6. All right, so these are not significantly abnormal. We would classify this as prediabetes when you're looking especially at that A1C level. So during this phase, what do we do as first line therapy for prediabetes? We recommend lifestyle modifications, right? With diet and exercise, low carb diet, exercising for at least 30 minutes, 5 days a week, right? Or if it's high intensity exercise, you can do 75 minutes instead of the 150 minutes for 5 days a week, right? So lifestyle modification for these patients who are pre-diabetic. Question number 2. A 45-year-old man is newly diagnosed with type 2 diabetes. His A1C is 7.8% and he has no comorbidities. What is the most? Is it A, a sulfonylurea? Is it B, a basal insulin? Is it C, metformin? Or is it D, a SGLT2 inhibitor? Take a moment and tell me what you got. All right, stem of the question here. What is the most appropriate first-line medication? Again, We have to run it back and see if they provided us with a diagnosis first. They have. They told us they're newly diagnosed type 2 diabetes, right? His A1C is 7.8%, has no comorbidities. But what is first line treatment for type 2 diabetes? It's metformin, right? Metformin, aka glucophage. So C is your best answer. Know your first line therapies, y'all. When studying, you need to make sure you know your first line. Make sure you know your gold standards across the board. And then lastly, question number 3. A 65-year-old male with type 2 diabetes and known ASCVD has an A1C of 10% despite metformin. What is the best next step in management? Is it A, add a sulfonylurea? Is it B, add a GLP-1 receptor? Is it C, increase the metformin dose? Or is it D, to initiate insulin? Take a moment and tell me what you got in the comments, y'all. All right, and some of the question here states, what is the next best step in management? All right, so still, when they're asking you for next steps with management, that's still a treatment style question. So we're going to look and see if we have a diagnosis provided. And we do. This patient has type 2 diabetes and known cardiovascular disease, right? Patient is 65 years old and also has an A1C of 10% despite being on metformin. Y'all, when an A1C hits 10%, remember, we need to initiate insulin at that time, okay? So your best answer is D. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you do need any of the resources that I offer, as always, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel. But as always, if you're looking to book any of my custom packages or plans, I want you to make sure that you are subscribed so that you will have access to the appropriate links and applications to get my custom packages so that we can get you set up and enrolled based on where you are. All right. But as always, you guys, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.